Well, good morning, everyone. We are room B312, and this is workplace mental health in the construction industry. I am Rod Owen, and I'm honored to introduce today's presenter, Mr. Mike Luster. To give you a little background in Mike, Mike is a Master of Divinity, an MSW, LCSW, is the lead clinician and trainer for Mental Health Resources, LLC. He is a licensed mental health professional and has been working in the field of mental health and crisis intervention for over 25 years in emergency rooms, the court system, psychiatric hospitals with youth and adults. Mike frequently provides training and consultation for businesses and corporations and maintains a focused partnership with the construction industry. Within construction, he provides keynotes, training, and skill development for every level of leadership, from the boots on the ground to the boardroom. In his off time, you can often find Mike in his family backpacking, with his family, backpacking in the Great Smoky Mountains. Please join me in welcoming Mr. Mike Luster this morning.
Thank you. Thank you. Excited about being here with you at Coverings 2024. I grew up in a construction family. So we moved, I remember, our family, we moved every 2 or 3 years, sometimes cross country, just following projects. My dad, he loved to build. And it's an industry that's been really good to us as a family. And I became a mental health professional and been working as a mental health professional for, about 25 years now. Worked in a lot of different contexts, working in hospitals and schools, churches, and a lot on construction sites and with construction teams. This may be a familiar sight to some of you within the tile and stone industry. This is an early morning all hands talk that I delivered as we're seeing more and more in construction-related industries. There is a topic, the topic of mental health and mental well-being is really coming to the top of the conversation. In what you might think to be the last place you would hear people talking about the importance of mental health in these construction-related industries. But something exciting is going on. There's a tremendous need that we're becoming more aware of, but there is also a movement within the construction industry that is actually becoming a model for other industries kind of across the board. I've worked primarily in emergency rooms. So seeing people coming in disabled by their anxiety or by their depression, seeing suicide attempts coming in. And your heart breaks just a little bit each time because everybody's story matters. And I got to a point where, you're just like, what can be done to prevent the crisis? What can be done to prevent things from getting to this point? So that led me to start an agency called Mental Health Resources. And we do have some cards going around. And we have a mission at Mental Health Resources. And our mission is to equip construction-related industries in how to understand, recognize, and respond to mental health challenges and substance use challenges so that people can thrive, so your people can thrive, so your team can thrive, so your family members can thrive. And at Mental Health Resources, we have a core principle that is at the center of healthcare, it's at the center of medicine, it's at the center of every one of your jobs. Before the workday's out, you will use this principle, no doubt, and that is this: early identification leads to early intervention, which decreases severity and prevents crisis. So in other words, the earlier someone gets help, the better the outcome. That works for systems, it works for people, it works for diabetes, for cancer, and it works for mental health. And so this is becoming a core strategy within construction companies and on sites, work sites, related to addressing mental health challenges. And as we talk a little bit about mental health and mental well-being within construction and construction-related industries, I just want to touch on three basic questions. One, what are we really up against? How widespread are mental health challenges? What level, what scope of challenge are we really talking about in the workplace? And how did we really get here to this scenario, so to speak? And then finally, what can we really do about it? And so when thinking about, what are we really up against in workplace mental health and construction-related industries, I want to share just a couple of quick stats. And I know some of these issues, especially when we talk about suicide and suicide prevention, that's something that really has touched all of us in some way. I had a mentor, he said, we were talking about this, and he said, Mike, you used to know someone who knows someone who had a friend who, and now you know someone or have experienced some level of loss related to this issue. But construction-related industries, they have the highest suicide rate of any other industry, and also the highest death by drug overdose rate. And this is really getting more and more attention nationwide, starting to see this type of research coming out. This other point that I wanted to share has really stuck with me, and that is within the construction industry, safety professionals know that they're very familiar with OSHA's Fatal Four. These 4 of the top accidents that claim lives within the construction industry. And if somehow we could just do away with them to where those accidents just never happened, we'd save about 1,000 lives a year in the industry. But we're losing 5 times that many within construction-related industries to suicide every year. So when you think about the money, the time, the training that goes into protecting against physical accidents on site, all the PPE and everything related to that, how much money and time and training is being spent about mental health challenges and some of these mental health challenges that can lead to crisis. And so I want to ask you, when we think about, okay, just how common are mental health conditions? So a stable statistic for many, many years tells us this, and this is not just within construction-related industries, this is across the board. It's about 1 in 5 people will have a diagnosable mental health condition at any given time. So 1 in 5, this is 20%. So, you think about this room, you think about your staff, your teams, think of this conference and the number of people attending. So that's somewhere around 20% of your workforce, of your team, have a diagnosable mental health condition at any given time, whether they're in treatment or not. The other thing that you can assume about that group is that they are, the majority of them are not getting treatment, are not getting the support that they really need. And so I want to ask you, if it's 1 in 5 people at any given time, what percent do you think over the course of a person's life would have a diagnosable mental health condition? What percent of people do you think over the course of their lifetime? About 50%? Now that has been a stable statistic for many years. It's just under 50%. But more studies have been coming out since about 2017 that show that number is as high as 80%. So somewhere between 60 and 80% of all people will have a diagnosable mental health condition at some point in their life. So when we when we say, hey, we are all in this together, that's not just a kind of a empty cheerleading statement that looks good on a poster, right? This is borne out by the data. And I think it's especially important when you're thinking about the primary driver of the severity of mental illness and the primary driver of suicidality and suicide attempts being the belief, I am alone. This shows very, very clearly you are not alone if you're struggling. It's all of us at some point. And so this also leads to, the economics of mental health, how this has impact the workplace and the industry from the standpoint of the bottom line. And so you see just a few of these points here, looking at workplace accidents. 80% of workplace accidents have to do with mental health conditions and related to stress. 40% of employees are going to take time off due to a mental health condition, regardless of what they call the reason. And it's still, mental health issues are the top causes of long-term sick leave. And so this definitely impacts our teams and our workforce. And I think that point at the bottom is really telling about the changing culture that we're looking at. When you're thinking about as leaders and recruitment, 86% of job seekers think it's important for a company's culture to support mental health. And you start to see that broken down by generations. You see those numbers there. 50% of millennials, 70% of Gen Zers have left a role for mental health reasons. So even with the generations coming on, thinking about recruitment and holding on to our talent, this is definitely an issue. Research has been clear for a long time in the workplace that when you invest in employee mental health, when you make it a point in your team and in your company to improve mental well-being, you see these results. You've got reduced healthcare costs. You've got reduced absenteeism. You've got reduced presenteeism. People that are there, but they're not really truly there. They're not fully present. It creates higher engagement when you invest in employee mental health, and you get improved productivity. And so you look at the ROI of investing in employee mental health, every dollar invested, you get $4 back in productivity. And so this research has been out for a while. So when you think, investing in mental health support with your teams, most importantly, it's good for the person, right? But it's also good for the bottom line when you think about your company and your organization. And so thinking about, these are some of the dynamics of how we got to this place in the workplace related to mental health. And so let's think about, how did we get here? And I want to share a point of research. And I want to ask you, people that work in construction-related industries, what do you think are the top reasons why construction professionals with mental health conditions do not reach out for help? Absolutely. Absolutely. And tell me your name. Don. Thank you, Don. That is at the top of some of those reasons. It's not just construction, it's most male-dominated fields we see this. And there's a mentality that if you have a mental health condition that, that you're weak, or it says something about your moral character or something like that. What else? What are some other reasons why? Denial about the condition? Absolutely. Or you don't even know you have a condition. You don't have to face your day-to-day like this. What else? For sure, accessing care. all of those issues related to access, insurance, financial, or even knowing how to, right? So turns out y'all didn't really need a research project because you all are very, very tapped into some of these reasons why. So this came at the top: shame and stigma about their condition, fear of judgment by peers. What's my team going to think if I step forward and say, hey, I need some help here? Fear of negative consequences. So now this impacts leadership. So what the people I report to, what are they going to think if I step forward and say, hey, I need some support here? And then, of course, not even knowing how to access care. The title to this study, which came out in 2021, I think really tells us kind of where we are in construction-related industries. And the title was "Concern for Mental Health is High, but Willingness to Discuss It is Low." And what about with leadership? So there's a study of 1,200 in management and leadership in construction. What do you think are their top 3 concerns about getting involved with suicide prevention in the workplace? Okay, I don't want to screw this up, right? I'm not sure what to do, and I definitely don't want to make it worse, right? What else? All right, liability, definitely one that comes up often. Any others? Okay, and I think, right. Right, and there can be another reason, a lot of reasons we might ignore it. We might not be familiar with the warning signs, we might not really know what to do to help, a lot of reasons. But I think you're definitely hitting on something there. So these were the top 3, and you all are mentioning these. Concerned I don't know how to help, concerned I might make things worse. And yet, there's still a fear of someone who may die on my watch. And so I want to zero in on the problem that we really need to be focusing on here, related to the situation, related to kind of this playing field that we're seeing. And, the problem is not the severity of the mental health problems. It's not the suicidal thoughts. The problem is that the majority of professionals in construction-related fields who are struggling with a mental health condition are not reaching out for help in the first place. Because, like many other male-dominated industries, construction-related industries have a help-seeking problem. And so what do we do? Because you could put all kinds of helpful mental health resources out there and put the posters up and all of that, but we see a large percentage of them, they're not coming. So what do we do about that issue? And so in thinking about what can we do about it? So we talked a little bit about what are we looking at? What are the realities here, and how did we get here? So what can we do about it? What's it going to take? It's going to take ordinary people doing ordinary things consistently and getting extraordinary results. So what in the world am I talking about? What does that look like? It looks like this guy. So you may not know this guy. This is Don Ritchie. So Don Ritchie was an Aussie. He lived near Sydney in Australia. And he, very, very ordinary guy, insurance salesman, had a wife, kids, and he lived across the street from this place called The Gap. And The Gap was this gorgeous, scenic place near Sydney with these sheer cliffs and this overlooking the ocean. You can see it behind him there. And all kinds of people would come and take in this view. Well, Don Ritchie lived right across the street from this place. So he would sit in his living room and kind of take in the view, kind of people watch a little bit, sip tea like Aussies do. And There was a time where he came to find out that this location was actually a location that some people who were suicidal actually sought out this place to attempt. And he began to notice people who he thought might be struggling a bit. And he would actually go out there and engage these people. He would talk with them and connect with them. And many of them, he would take them back over to his house, which was right across the street. They'd sit down, they'd have some tea, they would talk about whatever they might be going through, and he would just listen. Ordinary guy, not a mental health professional. So many of these people would come back to Don Ritchie years later and say, you know what, that one conversation saved my life. And the Australian government recognized Don Ritchie because the number of people that were prevented from attempting suicide that day came to about 180 people over the course of his life. And his family said, you know what, that doesn't even scratch the surface. The actual number is about twice that. So here's this ordinary guy doing ordinary things consistently and getting extraordinary results. And so how did he do that? I think that the biggest takeaway from this story is that he learned 3 basic skills just on his own. He learned how to recognize when someone may be struggling. He learned how to engage them in a non-threatening way. You know, he had kind of an opening question he would use all the time. He would approach them, talk with them, and he would say, hey, can I help in some way? It kind of started off the conversation that way. So he learned how to engage with them, and then he learned how to connect them to support that they may need. And so how can we address these challenges within construction-related industries? We can train our people in these same 3 basic skills. And in fact, that is what's going on nationwide. More and more, we're seeing teams, work sites, and people getting this basic training, not as a mental health professional. There's no intent to turn someone into a therapist or a counselor. This is just kind of like the mental health version of CPR, right? And you're much more likely to encounter someone who is dealing with a mental health challenge than you are someone who may be having a heart attack on site. All of that training is very important. But learning how to recognize, engage, and connect is crucial. And we see that when we train our people, and we're talking about from the boots on the ground to the boardroom. Our agency trains every level of leadership. When you do this type of training, and you train people on a site, someone on a crew, foremen, other supervisors, people in leadership offices, when you get some people trained, the people you work around the most every day are going to be the first people to notice a problem. So you think about the 4 or 5 people that you might work around the most in the offices, on sites, wherever that may be. These are the people that if they were beginning to struggle, you would be one of the first people to notice that something seems off. There seems to be some difficulty there. And with this basic training, you also get basic training on the best, easy next step resources that you could put in a person's hand. So it's not making you a mental health expert. All it is making people a little more aware and a little bit of training on how to connect with someone and just be that link between someone who may be struggling and the expert that they might need. And we see that this is the way that we can counter these barriers that are keeping people from stepping up and getting the help they need. And mental health conditions often tend to get worse without support, without treatment, just like any other illness. And when it's a member of your team or somebody you might see from time who's the one who notices that says, hey, man, how are you really doing? I can see this has been kind of a rough go this season. You know, whenever you're ready, if you need support, here's a resource for you. When it's a member of your team that does it, you're cutting across the shame and stigma. You're cutting across the fear of judgment by peers, because it's a peer who's reaching out and saying, hey, I see this has been difficult for you. Here's something that can really help. And also when leadership is setting the stage for that. Everybody creates culture from entry level to the top. And also, hey, I am struggling, but I don't know how to get help, so I'm just not going to take those steps. Well, you got something that says, here's an easy next step. So we see this is cutting through these barriers to people getting help. And also, same with leadership. I spent a lot of time with executive leaders, middle management, and also boots on the ground as well, every level. Because they are also stepping past their own concerns and learning things like, you know what, if someone is struggling and you actually ask them, hey, have things gotten to the point where you've had thoughts of suicide? Asking that question that most people are just like, oh, I would never want to ask that. I don't want to plant an idea in their head. Well, actually, research tells us over and over, asking that question to someone who may be struggling, not only does that not increase the likelihood that they may attempt, just asking the question decreases the likelihood that they may attempt. And so learning facts like that and just getting basic training has really made a difference. This is a safety director who just got trained in a course called Mental Health First Aid. Any of y'all heard of Mental Health First Aid? And so this is actually a certification course that does exactly what we're talking about. It helps people learn these basic skills and how to recognize, engage, and connect. And you see that mental health trained sticker on his hard hat there. And so I just want to share a little bit about some of the tools that we offer that's a part of the training. Again, there are courses called Mental Health First Aid. There are courses called QPR, is another certification course that we do. It's a 1-hour suicide prevention course that teaches you how to recognize, engage, and connect. And so this is one of the tools that our agency uses that people have really found helpful. It's called the WARP tool. Probably the most common question we get in trainings is, okay, Mike, life is stressful, all right? Life can be very depressing. So how do you know when someone crosses the line from the everyday sort of stress to a mental health condition that really needs some professional support? How do you know when things cross that line? So in other words, how do you know when a really difficult experience or loss becomes PTSD? Like, how do you know when drinking after the shift to kind of take the edge off, when does that cross the line into an addiction? Or when does just being down and being sad, when does that cross the line into major depression or clinical depression? So a professional ultimately is going to help someone answer those questions, but we can give you a tool that can help you know when it's time to talk to one. And so this is the WARP tool. So this is 4 important areas of our lives where mental health challenges can cause disruption in these 4 areas. 1 being work or school. 2, activities of daily living. This is getting up in the morning, feeding yourself, feeding your family, showing up at work with the equipment you need to have when you get there. Solving 100 problems a day you don't even think twice about. It's your executive functioning. Mental health challenges can disrupt all those processes. Relationships with your boss, with your spouse, your kids. mental health challenges can disrupt relationships. And then your physical health. That's probably the least understood area of disruption that mental health challenges cause. And I want to, just real quick, this is an example of the number of body systems that can be affected by mental health challenges. This is how mental health challenges affect your body physiologically. And not just anxiety, the title there, but across the board with mental health challenges. And so this is how, when I'm called to the emergency room by an ER doctor to do a consult, it kind of goes like this often. The doctor, she'll say, so Mike, this patient has been here for 7 hours. We've run every test we know how to run. Everything's coming up normal. Yet, they're still experiencing symptoms like these, sometimes debilitating symptoms. We can't find a physical cause here. We think it may be mental health related. So they would ask me to do, a full assessment. And so now you see why it takes so long to diagnose mental health challenges at times, because it's physical symptoms. We're looking for a physical problem. So it turns out that lower back pain you've been dealing with for about a year, you didn't have a fall or a car accident, yet you're having this back pain that can be really intense at times. It can be caused 100% by chronic stress. And we keep looking for a physical cause. What do you think is the average time it takes a person from the onset of mental health symptoms to the point of getting treatment? What would you say? From the first time it starts to show up to the point someone might get treatment. 3 months? Less? 3 years? All right, do I hear less, more? Going once? Going twice? How about 10? 10 years is the average amount of time it takes someone from the onset of symptoms to getting help. Can you think of what happens in the course of 10 years from someone who may be struggling? And so this again is probably the least understood area of disruption. And so the activities of daily living. So the WARP tool, again, going back, we got work and school impact. We're going to talk about that in a second. But activities of daily living, what are we talking about? We're talking about the 5 things human beings do. We eat, sleep, think, feel, and socialize. Mental health challenges can disrupt any or all of these daily activities. Let me ask you, what does depression, let's say clinical depression, do to your appetite, your eating habits? Absolutely. Too much or too little, right? What does trauma do? How does it impact your relationships? For sure. Oftentimes it makes them tough. And so what do? Oftentimes you withdraw, right? You disengage. You could start to see that on your teams. Someone in the office starting to disengage from the group. They used to eat lunch with the team almost every day. Now you just really don't see them at all. Just some of these little signs. The more signs of warp and these activities of daily living, the more areas that are disrupted, usually the more severe the condition. And so this is something that can help us kind of start to connect the dots. I'll tell you about one leader that attended one of our trainings and was trained on the WARP tool. And this leader had a traumatic experience at work and was really struggling with some depression and anxiety related to that. Got some basic training with the WARP tool, and they actually applied it to themselves. it was a way that they could look at what was going on, and they started to connect some dots. Wow, I'm starting to see my work relationships are being affected. I'm starting to see I'm having difficulty sleeping. I've been having constant colds. Mental health challenges do a number on your immune system, and started to connect these dots. And it was something that helped this leader think, you know what, I think it's time I go talk to somebody. They got help, they got support. Their depression was lighter and of shorter duration. As a result of getting that help, they were able to come out of treatment. They're doing really great today. And so this WARP tool can be a lens that can help us look through to notice levels of disruption. We're not training people to be clinicians. It's not important that we know, okay, what is the diagnosis and all of that sort of thing. We don't really need to know that so much as being able to identify disruption when it happens. And that's something for the experts to sort out. And so just really quick, kind of wrapping up this section with the WARP tool. This is what we call a WARP sheet, not to be confused with a rap sheet. But this is a WARP sheet looking at something like unregulated anxiety. Okay, how does it show up in WARP? In the work area, you might have a team member, you might have somebody that doesn't feel fully present. They used to be pretty engaged and well connected. You've noticed that they just kind of seem to zone out a lot now. You're having to communicate more and more, resend emails and communications. Their activities of daily living, they may have trouble focusing at times. You may have noticed they're starting to lose weight. And it seems like even minor things start to stress them out a little bit. And then maybe even their physical health, they're starting to call out more because of physical issues. Depression, you can see some of the ways that depression might show up in WARP in some of these different areas. And in mental health challenges often cause people to withdraw, which is very difficult because it's the very thing they need most is connection at that time. Substance use problem. They may appear, somewhat disorganized in their thoughts or in their work. Maybe they start to take some risks that are not really common for that person to do, not typical. You may know that they're going through a difficult time. Maybe there's been a separation from their spouse or something like that when you think about relationships. So it's just a matter of starting to connect these dots of what may be caused by a mental health challenge. And so that is a tool, the WARP tool. I want to talk about another tool, which is what we call coping strategies. And so these are probably the 5 most researched, evidence-based coping strategies out there. There are coping strategies that you need as an individual, some things that might work for you that may not work for me, but these 5, these are the type that every human being needs. And so I want to ask you, with these 5 up here, what would you say is the most important, most effective coping strategy, regardless of what mental health challenge you may be going through? What's that? Okay, healthy routines, very important. It's kind of a trick question because all of these are very important, but it's not the number 1. What would you say? What's that? Social connections. Absolutely. Absolutely. Especially related to people that may be struggling with depression or suicide, trauma, other issues, really, regardless of what struggle you have. What that person really needs is increased connection. And sometimes that's hard because they're in the process of trying to withdraw. But when you think, man, how do we help this person? Increasing their connection on some level, on a level that might be the easiest for them. But social connection is crucial. we always talk about healthy routines because it is very difficult to make forward strides with your mental health without addressing this issue, this category. What are we talking about with healthy routines? We're talking about, yes, eating right, getting exercise, getting adequate sleep. We could have a 3-day conference just talking about the impact of sleep. Did you know that your sleep, the amount of sleep you get, directly impacts your ability to regulate emotion? I have a buddy who was diagnosed with bipolar disorder, and I remember having breakfast with him, and this guy is probably the most cynical person on planet Earth, okay? And I'm Gen X, okay? We invented cynicism. This guy is like our poster child, and he used to be a stand-up comedian in LA. So if anybody would say, Mike, I have been awake for 4 days, and you're telling me to eat my vegetables, really? Not him. He's like, we're sitting there at breakfast, and he's like, dude, turns out getting 8 hours of sleep can change your life. And I'm like, yes, it can. Some of these things, somebody tell me, why do you think we don't execute very well on these things? Eating right, exercise, getting adequate sleep. Okay? If it's not on the calendar, it's not going to happen, right? Right. What else? Why else do we not? Absolutely. The schedule, the deadlines, finding time to do it. I think the reason we don't execute on this, and I myself have also been, guilty of Bojangles therapy. I think the reason we don't execute well is because we think those things are good things. Your mom still calls you, tells you to do these things. Our problem is we think they're good things. We just don't think they're essential things, right? We can power through. It is what we do, But to think, what kind of level could you perform at if you were actually addressing some of these things? And if you're struggling with your mental health, making some small baby step changes in some of these areas, you get huge impact from that with a little encouragement. So all of these are crucial. And so I want to ask you, and a lot of people, coping strategies, it's just kind of a psychobabble term. What are we talking about with coping strategies? This is just the thing you use to get through your day. What are the things that you do to get through your day or to get through the week? We all have them. You've had them since you came out of the womb. There are things that you did to kind of get through your day. And so I want to ask you, who'd be willing to share one or two things that kind of help you get through your day, something that helps? Yes. All right. Just taking a walk outside. Tons of research on that. Sometimes it's just taking a break from that situation that was kind of amping up your stress level, changing your scene for just a few minutes, right? And getting outside. Sunlight. A lot of research on that and its impact. What else? What's something else you do? Absolutely. And that comes into planning enjoyable activities. That also sounds like a pat answer when someone may be struggling with something, but there's so much research surrounding that. Just having that thing on the calendar, we know it's coming. We know we're going to take that time aside to plan an enjoyable activity, something like that. Any others? What's one more? Oh, for sure. Yeah, the breathing and everything. Yeah, for sure. These are all things that mental health professionals assign people that they're supporting. This is the homework, right? And these are all things that we can do. that in many cases prevent the need for medication in many cases. Sometimes prevents the need even from going into therapy and seeing a professional when we look at these practices that we do every day. So I want to ask you, what would it look like in your staff meeting or a huddle that you do to have that conversation and say, hey, you know, our mental well-being is important. We all have things that we do to kind of get through our day, get through our week. Here's something that I do. Tell me something that you do. And people start to share, just like we did here. And you don't have to say this is a mental health conversation or what have you. This is a, hey, how can we support ourselves, support each other, have that conversation? And before you know it, you've kind of started to create that culture of, hey, there are things we can do to be proactive about our mental health. There are things we can do, we can encourage each other that can really make a difference. And so I want to offer a couple of resources here. How many of y'all are familiar with 988? So 988, if there's one mental health resource that I could only give you one, that's the one I would give you. So 24 hours a day, you can call 988 or text 988 and reach a mental health professional, a crisis professional. You don't have to be in crisis to call this number. If you have mental health concerns, or if you might be in crisis, or a coworker's in crisis, or a family member's in crisis, or you've seen some things and you're like, this makes me concerned. I'm not really sure what to do. How concerned should I be? You can call this number and say, hey, this is what I've seen. This is what I've heard. Should I be concerned? What do I do? Sort of thing. And you don't have to give them identifying information if you don't want. But you can call 24 hours a day, get guidance for a situation, or get resources. Any rehab, therapist, support group, psychiatrist, whatever it is, they have the listing for it. And you can let them know if what your insurance is, or if you don't have insurance, whatever the case may be. It's kind of a one-stop shop. So definitely a number I would encourage you to put in your phone. These are a few helpful mental health apps. How many of y'all have apps in your phone that support mental health? Some of these are some that have been very helpful. Man Therapy is great. I would check that out for that kind of struggle with this whole topic due to what we pointed out earlier. I want to give you a resource. How many of y'all got one of these cards, the I'm Not an Expert card? I have these for you. Were they on a table back there somewhere? I want to give you one of these cards. And I can, let's see. I think I put a stack over here. I have a bunch of these, so we can just set them out here. The I'm Not an Expert card is something that we've been distributing on a pretty broad scale, but it is a card that you can give to someone who may be struggling. And so on the front, it says, I'm not an expert, and it also says, but I know someone who is. And you turn it over, you've got 3 resources, 2 QR codes. One of them goes to a self-screening tool. Now, this tool is outstanding. It's from Mental Health America, and it's made by clinicians. And essentially, if you feel like, or somebody else feels like, I might be struggling with a mental health issue, they can hit this QR code, they can go to a brief screen, depending on the issue, and get some insight into whether they may really need to see someone to get support for that. And if it does indicate that, then it automatically sends the person resources right then and there when they use it. The other is, of course, 988, dialing 988. We've had 911 forever for physical emergencies. Now we have 988 for mental health emergencies. So this is a great resource. I want you to leave with some of these. I'm going to put these out. Also, I think we have put out, I'm just going to put these here and make these available. Also, my contact card. But those are just a few resources that you can put in someone's hand. You know, if you had a supportive conversation, or make them available to your staff or your team, or if you happen to talk to someone, you know, this is a resource that you can put in their hand that can really make a difference. My card is here. QR codes on the back, the type of trainings that we offer. With that, I think we have time for maybe a question or two. If anybody has anything, I'll be around if you want to talk afterwards. I'll be here for a bit. So these are two online therapies, Talkspace and BetterHelp. Excellent. They can also be a very affordable option if insurance is an issue. And also, they have some that's totally online. If a person kind of wants that little bit of distance to try out therapy for the first time, they have some that's all messaging therapy, actually. And of course, telehealth is available there. So with that, we're going to wrap things up here. That's my contact up there. I would love it if you could raise a cell phone and hit that QR code and just give any kind of feedback. Is always important to us. We definitely want to dial this down and make sure we're hitting you right at your point of need. So we would love to hear from you there. But with that, I'm going to close things. And again, I'll be available, but thanks so much. I can tell this is a topic that's important to you all. And it's always great to be in a space like that. So thanks, everybody.